Okay, here we go. Let's talk about the ventricles of the brain. Um, the ventricles of the brain are nothing more than water sacs that run through the middle of the brain. And the way they're formed is the brain forms as a plate of tissue called ectoderm during development. We'll learn this later. And then it kind of folds up and over, and so the brain tissue is completely around this empty space, which is full of water. Now that water is actually cerebrospinal fluid, which we'll learn about. And indeed, there are several ventricles. This is actually a model here. If you take all the brain away and just look at the ventricles, that's what this is. These two big ones on the outside are the lateral ventricles that run through the two sides of the brain, through the cerebrum out here on the side. Then they come together. This becomes the third ventricle, and then this back here becomes the fourth ventricle. And then it heads all the way down the spinal cord through that little tube that's in the middle of the spinal cord called the central canal. Remember that? Okay. So we'll talk, and I think it's important to realize that the brain, when it forms and comes up there and folds around, that's a pretty important thing for that to happen. And if that doesn't happen properly, then you get a number of different problems created. The first one you've probably heard of called spina bifida. Spina bifida is when the spine, the vertebrae don't close completely around and back of the spinal cord. And a lot of times it's not very much of a problem, but sometimes it is. Sometimes kids, if the spina bifida is in their back here, they're actually paralyzed from that later down. And then there's others where it doesn't even close in through the skin. It sticks out through the back. Right. Right. Well, they're better. That's right. Yeah. Is the baby born?
Oh yeah, he's like 1.5.
Normal kid?
He has no feeling of one ankle down.
Yeah.
But
that's wonderful. Yeah. The worst stage of it is when the brain doesn't completely seal over at all, and then what the condition is called anencephaly, which means no brain, and basically they have no head either. I think I have some pictures for you, which are kind of unpleasant. So this formation of the brain around the ventricles is very important. We'll talk about it more as we go through this. The third ventricle is this one. It's the ventricle of the diencephalon. Like I mentioned, the diencephalon, remember, is just below the cerebrum. The lateral ventricles communicate with each other and with the third ventricle. And this model here shows that all very nicely with the two lateral ventricles hooking into the sides into the third ventricle, which is running back this way. The fourth ventricle is below that. Fourth ventricle is this one back here in back called the cerebral aqueduct and called the fourth ventricle. And we'll see it on some pictures here in a minute. Yes?
For the communication, it's just cerebrospinal fluid, right? It's not like there's neurons.
That's correct.
So communicate just means
Fluid is flowing
travel.
between them. Yeah. These are all just little collections of water, Jerry. This thing I'm holding. These are all just collections of water molded to illustrate what it looks like. And the way they get numbered, by the way, this is another weird thing. This is called the first ventricle, and this is the second ventricle. Two lateral big ventricles are the first and second. I don't know which one's right, which one's left. I don't think it's decided. And that's why the third ventricle is the next one, and the fourth ventricle is the last one. Okay? That's how that weird numbering system comes from. So here's this picture, which I wish I could see from back here. So these are the lateral ventricles, like I said, out here on the sides, going out through the cerebrum. They communicate here in the middle through the interventricular foramen right here. This is the third ventricle right here, coming on back to the fourth ventricle right here. The connection between the third and the fourth is called the aqueduct, or the cerebral aqueduct. And then it connects on back here at the very back to the central canal, which goes all the way down the spinal cord. The brain itself, let's talk about this for a second. It's a large, delicate mass of neural tissue containing lots of internal passageways and chambers filled with cerebral fluid. Each of the 6 major brain regions has a specific function, and the thing to remember, and probably the thing I want you to remember the most, is that as you go up in your brain, things get more complicated. The spinal cord is really simple. Your spinal cord doesn't think. It doesn't put any information together to come out with some other conclusion. So the only thing that comes out of your spinal cord is a few reflexes, like your knee jerk, and some other reflexes that go on. So just always know that when you're going from the lower parts of the brain, which in the lowest part really is the spinal cord, all the way up to the top, it's gradually getting more complex in thought and so forth. Most all of the stuff that we think of as thinking actually occurs up in the cerebral hemisphere. We have a lot of protections to our brain that help keep things intact for us. Clearly, the bones of the cranium, you remember studying the skull bones? Well, those skull bones are like a box, or they're like a football helmet that protects your head. Well, they're bones to protect your brain. And of course, the brain inside of there is kind of floating around in the cerebrospinal fluid, because there's fluid on the outside of the brain as well as fluid in the middle parts of the brain, too, in the ventricles, like we just talked about. There's also 3 layers called the cranial meninges. We've already learned these in the spinal cord, and you remember the tough mother on the outside is called the dura mater, and then below that is the arachnoid mater, and below that is the pia mater. Okay, well those are coatings on the spinal cord down here, but they're also coatings up here around the brain. There's also another concept down here that I want to explain to you as best I can. It's called the blood-brain barrier. How does that work? Let's just talk. I'm going to digress for a second and talk about the blood-brain barrier. Our brain is the most important organ that we have. If our brain isn't working right, we can't do anything. If our brain is not working, we can't protect ourselves. We can't run away from anything. Anything that wants can eat us, whatever. We need our brain to be functional in any way. So our body has all of these incredible mechanisms to protect our brain. Now, we need to protect our brain not only physically from being shaken or being cut or having a bullet go through it, but we also want to protect our brain from abnormal chemicals. And there's lots of chemicals that float through our body, and I'll just use one as an example. I'll use more than one. But I'll use one, it's pretty common, is our sugar, our blood sugar, okay? Now our blood sugar, if we're normal and we're non-diabetic, our blood sugar usually runs about 100, okay? And indeed, but it goes up and down between meals and after meals, and with a shot of insulin, if you have diabetes, it goes down, and it's kind of up and down. But we need our brain to have the same blood sugar all the time. We need the blood sugar to be 100 all the time inside the brain itself. And so we have this system called the blood-brain barrier that is around the brain. On the outside edges, there are cells that help us maintain it. Astrocytes. that allow certain things to go in and other things not to go in. So even though you may be diabetic, and even though your blood sugar may go up to 300 or 400, you're probably going to still feel pretty good. You're certainly going to be able to think, walk, and do what you need to do. Okay? Because the astrocytes in those glial cells are only going to allow the blood that's going actually into the brain itself to get up, to stay right at 100. They're going to control it. Okay? Yes?
So, when there's cases of people who like lose brain function or whatnot, like that's how they find out they're diabetic or whatnot, is that because the blood-brain barrier has been breached, so their blood sugar is higher in their brain now?
Yeah. Your blood, you start becoming comatose with high blood sugar, usually when your blood sugar gets to about 1,000. And when it gets that high, the blood-brain barrier can't keep it at 100. And so people get goofy and get comatose. And that's how they present. They didn't know they were diabetic until that point. Yes?
How exactly do the astrocytes do that?
That's really magic. Man, it's just really magic. Yeah. They just kind of all get around and they hold hands and they say, listen, we're only going to let a certain amount of blood sugar go through here. That's really how they do it. They form a barrier, a blood-brain barrier.
They just get felt in it.
Yes. I hope you did. All right, now here's another example. People used to get meningitis, and they'd have an infection inside their brain. And we would say, oh, well, meningitis, let's see, it's streptococcus, so we can just give them some streptomycin or some, one of these drugs that were just first being invented in the 1940s. And we can just give them some streptomycin out here in their vein, right? It'll percolate into their brain, and it'll clear up this infection. Wait a minute, not so quick. Because certain drugs can get through the blood-brain barrier, and certain drugs can't. So what we found ourselves doing, and I'm speaking generically as a physician, is that we would try to find drugs that could get through the blood-brain barrier, and some of them could and some of them couldn't. It was totally trial and error. And when we didn't have a drug that would get through the blood-brain barrier, but it was the only antibiotic, for example, that would kill the bacteria that we knew were living in there, we would shoot the drug straight into their brain. Whoa! Yeah, that's what they would do. Because that was the only way to bypass that blood-brain barrier thing. Well, these days we know exactly what can go through the blood-brain barrier, we know exactly what can't, and every drug that we need to get through the blood-brain barrier, we have been able to alter it a little bit chemically so that it can now get through there if we need it to get through there. So the blood-brain barrier is a kind of a mysterious thing, I'm just telling you. And it's kind of it's a chemical barrier so that only the good stuff gets into your brain. Because let's face it, we don't want all the bad stuff to go through there, especially if it could paralyze our brain in some way. Okay? Read about it. The cranial meninges, they have 3 layers. We've already talked about them. They're continuous with the spinal meninges, and they're there to protect the brain from cranial trauma. We have a bag of brains up here, and y'all get, these are not for humans. These are sheep brains. And each table or each pair of you, however many of you want one, can have one. And you'll cut them in half here in lab, and you'll learn all parts, and you'll find that to be very helpful. But you notice that these brains feel like they're kind of rubbery and kind of tough, and so forth. That ain't the way it is, okay? The only reason the brains are tough like that is because they've soaked in this preservative for months. Right when they come out of the head, it's like Jell-O. Your brain, sitting here in the room, all of these brains are just like Jell-O. And that's why when you shake a baby, think of the brain as being like Jell-O in there, but it has little blood vessels running through it. Okay? And think about if you took a piece of Tupperware and filled it up with Jell-O and put the top on it, okay? And then you took that, let it solidify, let it turn into Jell-O, and then took it and shook it, okay? And then took the top off and looked in there, there would be a whole bunch of tears in the Jell-O, right? That's what shaken baby syndrome is. That's what happens with babies when parents shake them. And it's a tragic injury. These kids are usually retarded for life and have all kinds of visual and other problems as well. So, and why am I saying this? When I was a kid, I read this book about Abraham Lincoln. And you guys maybe read books about Abraham Lincoln too. And one of the stories, and I remember reading the last chapter, and the last chapter was about his assassination. And John Wilkes Booth put a gun to the back of his head and blew a big hole in his brain back there. And the doctor was called, and he looked at him and he said, "Oh, he stuck his finger in the hole, and he said, 'This is a mortal wound. He's gonna die.'" And they said, "Well, what should we do with him?" And they said, "Well, let's pick him up and let's take him across the street. There's this boarding house, and let's just let him lay there until he's gone." And that's what they did. And they laid him in a bed, and they only had one double bed in the whole place. And he's a tall man, and they had to lay him on an angle across the bed. Funny the details you remember after all these years, you know. But the thing I remember was that as he continued to lay there through the night, his brain kept seeping out through the hole. And that's the way it is for all of us. Your brain is really like soft Jell-O. And if you make a hole in your head, your brain's going to come drooling out. It's not like what we give you here in lab. Okay? That's really the point I wanted to make, is that what we're giving you here is not reality. Okay? Because it's been soaked. Well, here's another story about that. John F. Kennedy, as you know, was assassinated in 1963, and his body was brought to Bethesda Naval Hospital, where I wasn't there at the time, but that's where I went. Spent 9 years of my life up there in the Navy, learning surgery and medicine and so forth, and teaching. And they took him to the autopsy room there, and they did an autopsy on him, and they didn't do a very good job. The science of forensic pathology was not in existence in 1963. There was one guy in the whole United States who called himself a forensic pathologist. He was a professor over at Johns Hopkins University, which just so happened was only 30 miles away over in Baltimore. But they didn't call him. So these dumbass senior Navy pathologists did this autopsy on him. And at the end of it, they said, well, you know, his head's about half blown away. Let's take his brain and let's preserve it, and we'll study it later, because that's the way you have to do it. When you study the brain, you have to preserve it for like 3 months until it gets stiff, and then you can cut it up and really figure out where the injuries were and so forth. Well, his brother was Robert Kennedy, and his brother just so happened to be the Attorney General of the United States. And there was a whole bunch of photographs taken at the autopsy that you've probably seen since. Well, Robert Kennedy, RFK, did not want those released to the public, and they weren't released until about 10 years ago. They were totally secret. He certainly didn't want his brother's brain showed to the world, being blown apart. And so he went out to Bethesda a day or two later, before they even buried John, and he got the brain. He got everything. He got the clothes. He was the Attorney General of the United States. Come on, he was the #1 law enforcement officer for America. He got it all, and it all disappeared. John F. Kennedy's brain has never been found. We've never had an actual autopsy done on his brain because of that. But it was soaking. The docs put it in stuff, and who knows? It's probably stiff by now, wouldn't you figure? Okay. Crazy, huh? Anybody see where I left my clicker? I hate it. I hate it when that happens. What? Over by the brains, maybe so. Oh, thank you. I appreciate y'all looking after me. Okay, let's talk about dural folds for a minute. Dural folds are where the dura kind of takes a fold down into the brain. And the biggest one is the falx cerebri. And let's just think about that. Here's the top of the skull up here at the top. And then over here we've got this lobe of the cerebrum, and over here we've got this lobe of the cerebrum. So this is brain, and this is brain. And here comes the dura. Here's the dura out here like this. And the dura takes and folds down in through between the two lobes of the brain, and it does like this. It folds back up like that, okay? And this fold of the dura is called the falx cerebri. Falx meaning midline, cleft, kind of down through the middle, and the cerebri. Down here at the bottom end of it, doesn't really all fuse together. These kind of fuse all the way up through here, and form kind of a sheet of dura that kind of keeps the brain from sloshing from side to side because it's this tough supportive stuff. But down at the bottom, it forms a blood vessel. That blood vessel, we're going to learn, is a vein. It's a venous sinus. And it forms another one up here. And this one's called the superior sagittal sinus. And this one's called the inferior sagittal sinus. Sagittal meaning in the midline, right? And so you have two sinuses, one at the top and one at the bottom. And in between is this double layer of dura, which is called the falx cerebri. Okay? So that's one of them. That's the biggest one. And you'll see that on your sheep brains, and you'll see it on our models. Then there's the falx cerebelli, which is the exact same thing, except it extends down between the two lobes of the cerebellum. Okay? So the dura kind of sneaks down in between the two lobes of the cerebellum, remember back in here. And then there's a third one called the tentorium cerebelli. Tentorium probably makes you think tent. Okay? Well, it's a fold of dura that kind of forms a tent, and it forms the division point between the cerebrum above and the cerebellum below. So the tentorium cerebelli is back here in the back and divides the cerebrum above from the cerebellum below. Okay? We're going to learn about cranial blood flow and how the blood flows into the brain and how it flows out of the brain. But it always flows out through these veins, these dural sinus veins. It's an important part of the thing. So here's the three of them again. Falx cerebri, I drew it for you over here. It contains the superior sagittal sinus up here at the top and the inferior sagittal sinus down here at the bottom. The tentorium cerebelli is this tent down at the back of the cerebellum, between the cerebellum and the cerebrum, and it contains the transverse sinus. We'll talk about that as well. The falx cerebelli divides the cerebellar hemispheres. It's also in the midline. Now let me tell you, the falx cerebelli is pretty damn unimpressive. It only extends down in between the lobes of the cerebellum about that far, whereas the falx cerebri up top, you know, pretty significant in size. Just a kind of a close-up picture. You should read through this section in your book about the meninges. But here's the dura mater, the outside layer of the dura mater, called the endosteal layer, which means it's right up against the bone. And then there's the dural sinus with blood flowing between it. Here's the inner layer of the dura mater called the meningeal layer, because it's right up next to the other meninges, the spidery one called the arachnoid mater, illustrated here, and then the pia mater, which is the last little layer, which lays right on the brain itself, and then the cerebral cortex, shown in yellow here below that. Here's kind of if you took all the brain out and just left the dural folds, this is what it would look like. It's a really nice depiction of this. So here's the falx cerebri extending down between the right and left lobes of the cerebrum. The one at the top is called the superior sagittal sinus. The one at the bottom is called the inferior sagittal sinus. Here's this little bitty falx cerebelli back in the back that supposedly divides the two lobes of the cerebellum, but you can see it's pretty pitiful. And the tentorium cerebelli is illustrated right here, and you see it forms a tent between the cerebrum above, the cerebellum below. And you notice that there's a sinus here. This is called the straight sinus, and the blood comes this way, and it comes this way, and the blood in the straight sinus here goes back. Everything all meets up back here at the back of the head, and from the transverse sinus it goes outward, and then it wanders around and comes down, and eventually it's going to turn into the jugular vein. Remember the jugular? No, you haven't had jugular vein yet. Yeah, jugular vein is going to carry the blood back to the heart, down through the neck. And I have a nice animation to show you, and except I'm not really set up to do it, so I'll do that next time. We'll stop right there. It's a nice little cartoon depiction of blood flow through the brain. Okay? All right, so we've gotten a start on things. We'll have a quiz next Tuesday. It'll be over what we've talked about today and what we will talk about on Thursday, just so you know. Yes?
Are you going to sneak in chapters 12 and 13 in that quiz or
No, I'm not. That's a good question, though. If she's giving you a hard time, you tell her, I think that was a really good question. You're welcome.
Hey, I talked to you last winter term about me. I have to leaving to see my nephew.
Yeah.
And I sent you an email with my date, so I'll be gone on Thursday and Tuesday.
Somebody left their iPhone up here. Remind me, when is it?
I leave early morning Thursday to get back late night on Tuesday.
Oh, okay.
Can I maybe take the quiz in between lecture and lab on Thursday?
Of this week?
Next week. I won't be here. I leave at 5 in the morning.
Yeah. Yeah, sure. Just remind me.
Okay,
Send me an
cool.
email. I don't like to have to keep track of things like that.
Okay, thank you.
Yeah. No, that's for you to keep. Or throw away. Thank you. I'm doing okay. Get the 3, 2, 1. Okay, so we will record this. Can you flip a couple of lights off back there? Thank you very much. No, they won't. They won't. Okay, so yesterday, is this where we got to?
Yeah.
Okay. So we were talking yesterday about the brain and how it sits there in this pool of jelly, kind of, or this bottle of the water that's all around it, which we call cerebrospinal fluid. And we talked about the functions of the spinal fluid a little bit, I know. not only to cushion everything, support it, also transport nutrients, chemical messengers, and waste products, just like it says there. Where does the cerebrospinal fluid come from? And you kind of need to know, where it comes from and where it goes to. Yes, sir.
Ependymal cells and the glial cells.
Oh, very good. And what do you call that thing? Ependymal cells help make it. They're glial cells. And it's made up in the choroid plexus, okay? The choroid plexus are these structures that you will see in the brains that we give you today, later over in class. And this is driving me crazy. Oh, here it is. But the choroid plexus live in the bottom of all four of the ventricles. So at the base of the first and second ventricles, the two lateral ventricles, in the bottom of the third ventricle, and in the bottom of the fourth ventricle, there's a choroid plexus. They look like a bunch of little squiggly, tiny blood vessels, and that's really what they are. They're covered with these ependymal cells, and they secrete the cerebrospinal fluid. So they're making the fluid at a grand total of about 500 milliliters a day, which isn't really very much. What is that? 20 milliliters an hour? Something like that. So it's not a high flow kind of thing, but the fluid stays in there where it's supposed to be. It participates in those functions right there. So where does it go? Because in addition to knowing where it's made, you're going to need to know how it flows, because it flows around the brain, it flows down around the spinal cord in the subarachnoid space, it flows down through the spinal cord in the central canal, that little hole in the middle of the spinal cord. You remember that one from last term? And so that fluid, how does it get there is the point to know. And where does it get out of the system? The place it gets out of the system is at the arachnoid villi, and they happen to live up here in that superior sagittal sinus. So we said where it was made. It was made in the choroid plexuses, which is in the ventricles. It leaves the brain, it leaves the cerebrospinal fluid through the arachnoid villi, and it releases the fluid up into the sagittal sinus. In other words, it puts it back into the bloodstream, and then it circulates around through the bloodstream, and you pee it out or do whatever it wants to do with that water. So let's just take a look at a diagram here to see a little bit about how this works a little better maybe. And I told you that the cerebrospinal fluid is created in the choroid plexus. Now here's a choroid plexus right here that you can see. And like I said, when we give you the sheep brains, you'll actually see the choroid plexus. They look like little squiggly, tiny little blood vessels, but they look like blood vessels. And there they are. And then they're also found in the third ventricle down here and also in the fourth ventricle down here. So all four ventricles make CSF, okay? Now notice that the ventricles where they make the CSF is inside of the brain, okay? It's in those where the brain is looped over and it's formed on the inside of the brain, but then I also told you that there's CSF around the brain. So how does it get out of the brain? Well, the fluid flows back in through here into the fourth ventricle, and in the fourth ventricle there are actually three holes. One is medial, it's called the medial aperture, and there are two lateral ones called lateral apertures. Isn't that amazing? And that allows the fluid to come out of the brain and come out here around the brain into the subarachnoid space. So it completely encircles the cerebellum, it completely fills the subarachnoid space or the spinal space down here. That's where you do, when you do a spinal tap, you know, when you put a needle in somebody's back to draw, that's where you get CSF from to study, is through the lower back, putting a needle back into the, right through the dura and then into the subarachnoid space, and then boom, out it comes. And it's really pretty easy to do. I mean, it was one of the first procedures they let us do as medical students because there's not too much you can screw up. And I don't think I ever missed. It's pretty easy. We'll talk about that a little bit more in a minute. But anyway, so here it comes. Now it's outside. It's around on the outside of the spinal cord and on the outside of the brain. And then it's eventually going to come up here to those arachnoid granulations that we just mentioned, which are where the CSF is picked up and put back into the bloodstream. Okay, put back up there into those dural venous sinuses, and then it gets back in the bloodstream and, you know, it goes and does whatever you want with it. These are kind of close-up diagrams just to give you the impression. Here's an arachnoid granulation. You see it sort of sticks up into the blood flow in that superior sagittal sinus. And remember which way the blood is flowing through the superior sagittal sinus? Backwards, right. And leave it at that. Here's a picture of the lateral aperture, a couple of holes right here. There's two lateral apertures, and then there's a median aperture, a little bit lower, right here just below the cerebellum, where the fluid gets out from the inside of the brain and goes out into the space around the brain to fill that with CSF as well. I think that's all I need to talk about there, and there, and there, and there. I'll come back to that later. Let me just talk for a minute about your back. Sherry, would you stand up for a second? You know, you remember when we studied the spinal cord last term, and we said that the spinal cord actually ends at about L4, L3, L4. So if you have a patient and you're going to do it, a tap on their back, you know, you don't have to take all your clothes off. But you can basically feel for their hip bones, and that's usually at L4, yeah. And so as long as you're below that, there's no spinal cord. Remember, the spinal cord kind of plays out, and what is it that's located below the spinal cord? Cauda equina, right? It's just a bunch of nerve roots at that point. And the good thing about it down there is if you put a needle and you put it in one of those nerve roots, they just kind of bounce out of the way. And you don't do any damage to them. Occasionally, and I don't think I remember this once or twice, but when you're going to put a spinal needle in, they might have just an electric shock down their leg. And that tells you that you tweaked one of their nerves, but you're not going to do damage to it. Whereas if you put the needle in up higher than this, and it was actually spinal cord, and you put the needle into the cord, and you hit a little bitty blood vessel in the cord, even if it just bled 3 cc's of blood within the cord, it would cause pressure on those tracts, remember? And cause damage to the patient. So you just always have to stay low. And basically all it is a matter of getting them to bend over, push their back out at you, and feel for the midline, clean it off, put a needle in. And the needle has a little trocar down the middle of it, and you pull the needle out. If you think you've just popped through the dura, you pull the needle out, and if fluid comes dripping out, then you're in there. If it doesn't, you put the trocar back in, advance a little bit farther until you come out. And then this nice clear fluid should come out. Put a syringe on it, draw up 5 or 6 or 7 cc's. Take everything out. Take that fluid and put it in culture tubes, put it in chemistry tubes, have them, do cytology. Are there any malignant cells in there? Are there any bacteria in there? what's the blood sugar, what's the sugar level in the CSF, what's the other chemicals in the CSF. And you can diagnose a whole bunch of different brain problems with a few cc's of CSF. And so that's the whole deal, is just remembering your anatomy, and your anatomy told you where the spinal cord ends, and as long as you're below that, you're okay. And we'll talk later about epidural anesthesia when we get to that. Thank you very much. Okay? Let's talk about the blood flow to the brain. We're going to come back to that CSF flow. I've got a couple more videos to show you about that. But the blood supply to the brain basically comes up through 4 arteries. Now think about it, and think about how important your brain is to you. And so it's pretty important that you have good blood supply to it. And indeed, your brain does take a lot of blood. It takes a lot of oxygen, and it takes a lot of sugar. Because the brain tissue itself can't burn all these other products. It can't do gluconeogenesis. It can't burn proteins. It can't burn fat. It can only burn one thing, and that's glucose. So you have 4 blood vessels. The big 2 are the carotid arteries here in front. You can feel them. Let's feel them. Nice strong carotid pulse. You should be able to feel just lateral, just medial to your sternocleidomastoid and just lateral to your neck muscles and your thyroid cartilage and cricoid cartilage, right? Okay, then you have 2 more that are called the vertebral arteries, and they run up the back of your neck. Well, every time I think about the value of the vertebral arteries. Now, remember the route, the vertebral arteries come off right here in your chest. They go up through the back of your neck, and when they get up to your cervical vertebrae, where do they go? They what? Through the vertebral canals? Through the transverse foramen. You remember the cervical vertebrae, the 7 cervical vertebrae have those little transverse foramens out there. And the blood vessel that's going up through those little transverse foramens on either side is the vertebral arteries. Now, so then the vertebral arteries come up and they go up into your brain up here through the foramen magnum, and then they join together, and the 2 of them from either side join together and form the basilar or basilar, depending on if you come from Arkansas, the basilar artery, and then the basilar artery goes up and joins in with your circle of Willis, which you guys haven't learned yet, I guess. But basically, we have a circle at the base of our brain down in here that gets blood from all 4 of these vessels. It gets both carotids feed into this circle, and both vertebrals via the basilar artery feed into this circle. And why is that valuable? Why would it be valuable to have a circle of Willis that can take the blood from one artery and shunt it out into other parts of the brain? What? In case one gets injured, yeah. Or in case one gets totally blocked off, yeah. We used to have patients sent to our office. We did a lot of vascular surgery, and we did a lot of carotid surgery, and we did a lot of ultrasound. We had a big, fancy vascular ultrasound machine in our office. So people would get referred in to us. Maybe they'd had some kind of little TIA. They'd lost the strength in their arm or their leg, but then it had all gone away, and you'd study them, and about once every 2 weeks, we would have a patient who comes in who looks perfectly normal for all the world to see, but yet when you study them, one of their carotid arteries is completely blocked off. It's blocked off from arteriosclerosis, heart in the arteries, biggest disease in our country, right? And you'd think, well, gosh, how did that patient survive one of their carotid arteries just completely closing off? That should have given them a stroke, right? Because this side of this carotid carries blood to this side of the brain, and that's a big problem. But it's not, because they have an intact circle of Willis, and blood from the other side can go across through the circle and get up to the other part of the brain. And so people can do okay. It's a real protective mechanism. Now, another protective mechanism is that those foramens through those bones up there, right? Have you ever seen? I saw a video on the tube the other night of these two tigers fighting, and you know what they always go for? They always go for the neck, right? So isn't it nice that if somebody comes up behind you and bites your neck, they're probably not going to get your vertebral arteries. Why? Because they're encased in bone. They're really well protected on the way up the back of your neck. And that's the whole deal, is to be sure that you got some blood vessel that can get up there and carry blood to your brain. Okay, so the four big arteries going up are the two internal carotids, the two vertebral arteries. All of the blood from your brain itself basically is shunted down through and goes out through the jugular veins right here in your neck. And they run right next to the carotids. And I always, here's a nice picture of it. Here's the vertebrals. You see, here's the big artery coming up out of the heart. And here's the vertebrals coming right off the arch here and coming up this way through those lateral transverse. Thank you. You know what I'm trying to say. And then they come back up here into the back of the brain, and we'll talk a little bit further. In the front up here, your carotid arteries, this is called the common carotid down here, and then the common carotid splits right here in your neck. And one branch is called the internal carotid, and it doesn't have any more branches. It just goes straight up to the circle of Willis up into the brain. So it does nothing but carry blood to the brain. And then the external carotid, this one out here, it kind of spreads out over your face and carries blood to your tongue and your cheeks and your mandible and all of the good stuff on the sort of on the outside here. Here's the circle of Willis shown pretty nicely. Here's those two this is the back here. Here's the spinal cord. Here's the two vertebral arteries coming together here to form the basilar artery. And then they get up to right here and they form this circle here, which is called the circle of Willis. I think there's a fancier name for that these days. I think it's called something like the cerebral circle. They try to take all the names, the eponyms out of things, but it's still the circle of Willis for me. And then off of the circle of Willis comes all the major branches that go to your brain. So here's the posterior cerebral, which goes to the back part of the cerebrum. Here's the middle cerebral, which goes to the middle part of the cerebrum. And then the anterior cerebrals up here that carry blood up here to the front part of your brain, anterior cerebrals. Cerebellum, right? What's this thing, this funny looking thing here? Just in front of the cerebellum, the pons, right? Okay, what's this right here? Pituitary gland, right? So the pituitary gland sort of sits in the midst of the circle of Willis. Why might that be important? Yeah?
Because the pituitary is like the master gland, and like if all the hormones are being like controlled by the pituitary, the circle of Willis can carry the hormones where they need to go.
Yeah. Well, that's certainly the pituitary is very important. What might be the relationship between these arteries being so close and the pituitary gland living right there? Yes.
So if something did happen to one of your arteries, the pituitary gland still has access to like nutrients.
Yeah, well, the pituitary gland basically gets its blood from the brain up top. Yeah. But here's the go.
Well, since it's a gland, it probably helps it with since it helps with the whole body and whatnot. Basically, it's.
Well, sure. If the pituitary was damaged, the pituitary would, you would have a lack of one kind of hormone or another, one of the releasing factors at least. Anybody ever heard of a cerebral aneurysm? Your grandma had one. I had a student in here last term, and I'm sure his pictures will come up before we get to the end of this PowerPoint. His mother had a big berry aneurysm. We call them berry aneurysms because they look like berries. And then they come right off the circle of Willis right here usually. Usually at one of the junctions, there's a weak spot develops, and so the artery bulges out, and you have this big bulge coming out there. Well, if that big bulge pushes on things, what might it bulge on, and what might it push on? Well, first of all, what's this thing here and that thing there? You don't know yet, probably. Optic nerve. Yeah, so it makes your vision go away sometimes, depending on which piece of these nerves, and we'll learn about them when we get to the end of this chapter in the cranial nerves. But yeah, and there's another part of the, well, what lives in the posterior pituitary gland? Anybody know? Once again, we haven't gotten to it yet. We'll just let that ride. So just so you know that these things all live really close to each other, right up there in the middle of your head. All of these arteries and the pituitary, the hypothalamus, the optic chiasm it's called, where the two optic nerves from the two sides come together, and we'll come back to them a little later. Here's the veins. Please don't waste any time learning the names of the veins. Just always know that the veins are named the same as the arteries. And I have a slide I'll give you later when we get to the vascular system. There's really like only 7 veins in your whole body that have a different name than the arteries do. Otherwise, they're all named the same. So anyway, that's what we just saw in that little video this morning. And here's a nice picture of the venous system in the neck. And once again, you do have some vertebral vein coming down through the transverse foramens there. But here's your main internal jugular right here. Now, everybody take and kind of hold your neck to the other side and feel the edge of this muscle that goes down here. Remember this name of this muscle? It goes from this mastoid process back here, and it comes down here to the sterno and the cleido, and we call that the sternocleidomastoid muscle, right? Okay, well, it's a very useful landmark, and my story that I usually tell on this one is I was a very young, impressionable medical student, and I was working in the emergency room in Memphis, Tennessee one night, and they flopped this guy in on the table, brought in by a couple of cops and a couple of ambulance drivers, and he was dead. I mean, I thought he was dead. He had no heartbeat, he had no pulse rate, he had no nothing. And everybody sat around and said, God, we got to get IVs in this guy. And everybody started trying to get IVs in his arms and legs and so forth, and nobody could do it. And there was this one internal medicine resident who I've never forgotten, and I will always think was one of the smartest people I ever saw. He said, just a minute, put his feet up a little bit. So he elevated his feet on the gurney, and he said, give me an intracap, and he prepped his neck a little bit. And he reaches up here with his fingers, and he kind of pushes the sternocleidomastoid out to the side, and he sticks this needle in right there, and he gets right into the internal jugular vein. He feeds the catheter in, give the guy some medicines, and boom, he wakes up. It was a drug overdose, like most dead folks rolling into ERs are. It seemed like, at least in the inner city of Memphis, Tennessee, it was. And that guy saved that guy's life. Now, how did he do that? He did that because he knew the anatomy. He knew the anatomy. He knew that vein was there. You couldn't see it. You can't feel a vein, right? And if they don't have a good pulse, you can't even feel an artery. But he knew where it was. And he had done it enough times that he just kind of went, here, pull a bit. Never forget it. Never forget it. I never was able to be a star quite like that in my career. Quite that much, but there was...
You are now.
Huh?
You are now.
Oh, yeah. Anyway, cerebrovascular disease, just for a minute here. The blood vessels going to your brain are very important, and the blood vessels going to your brain develop arteriosclerosis quite a bit, and that leads to strokes Another name for a stroke is a cerebrovascular accident, or a CVA. I don't know why we started calling them that long ago. It seems silly. Stroke is a lot shorter and means the same thing. But basically, a stroke means that there's a piece of your brain that doesn't have enough blood flow. Now, you can throw a little blood clot and it goes to your brain, and it might go to the part that controls your vision. And so for a few minutes, you can't see through one of your eyes, for example, okay? And you may get a little stroke, a little blood clot, or a little piece of cholesterol that breaks off and goes up to your brain, and it makes it so you can't feel. So you can't feel your right arm. Well, that means that the problem is on this side over here, because remember, the left side of your brain always controls the right side of your body. So it's gone to the sensory area up here, and a lot of times these things will just clear up and go away. But if they're bigger, then they don't. And so then people are left with what's called a stroke. And if you shut off the blood to the portion of the brain and you just shut it off for a minute or two, it's going to be okay. And then if that clot can kind of wash on upstream or start dissolving away and some blood can get around it, then that patient's going to be okay. But if it's a bigger one and a bigger clot, and it clots off a bigger artery going to a piece of the brain, the neurons, the brain cells that are upstream from that, are going to die. And so if it's a really big area, and you've probably all seen people that have had a significant stroke, they're completely paralyzed on one side. They may be completely paralyzed, they may be numb as well as paralyzed, but that's what they got. And they got to live with that because it's not going to go away. They may get better, and other parts of the brain may kind of take over a little bit for it. But a patient that's had a big stroke is in a world of hurt, and probably always going to be. I talked to you already about the blood-brain barrier, and I don't think I'm going to say anything more other than to say that it's important that you know about it. It's important that you understand why it's important. It controls the chemicals into our brain itself. And it's a kind of a nebulous, fake-o thing. Oh, there's this blood-brain barrier. Well, where is it? Well, it's all around the brain. Well, where is it? Well, it's all around the brain. What does it? Oh, those astrocytes do it. What do? Well, they control permeability of the endothelium of the blood vessels that go up there. So remember we talked the other day about the sugar and how, you can walk around and have a sugar level of 1,000 and probably feel okay. But at the same time that your blood sugar out in your body out here is 1,000, the blood concentration of glucose in your brain is going to be 100 because that's normal. And the blood-brain barrier will always control the blood glucose level in your brain itself because the brain needs sugar and it needs just the right amount. It doesn't need too much, and it certainly doesn't need too little. Now, so if your blood out here if it's really out of control and you have diabetes, it might go up to 12 or 1,600, and at that point, you're going to probably get comatose. You're going to probably be in diabetic coma because eventually the blood-brain barrier can't keep the amount of blood sugar in your brain itself normal. Okay? It works for other drugs too, and we talked about some antibiotics, I believe. Okay. I've said enough about that. There are 4 places where there's a break in the blood-brain barrier. I don't know. I don't want you to memorize this list, but just know there's portions of the hypothalamus where some of the hypothalamic hormones are secreted that bad stuff can get in. Posterior lobe of the pituitary gland, that's what makes ADH. What's ADH? Who knows what ADH is? Antidiuretic hormone, yes. And oxytocin, what's oxytocin? Yeah.
Love drug is the
A love drug. Wow. All right. It's the one that makes your uterus go into contractions, makes your milk release when you're breastfeeding, and I guess it's the love drug. Never really quite thought of it like that, but maybe I should. Pineal glands and the choroid plexus. Remember, That's where we have a lot of ependymal cells that help work on this blood CSF barrier, but we're talking here about the blood-brain barrier. Two different barriers. Let's go on. Let's talk about the medulla. Medulla is one of the parts of the brain, right? Which part is it? It's the lowest one, right? It's right where the spinal cord turns into the brain itself. And so remember we said that as you go up through the brain gets smarter and gets more complex and starts doing more complex things for you. The medulla is basically what allows the brain and the spinal cord to communicate because it sort of runs through it. It controls the visceral functions. The medulla is what controls your blood pressure, your pulse, digests your food, all of these automatic things, also autonomic things that we don't really want to have to think about. We don't want to have to waste our brain deciding when our stomach is going to contract the next time, right? Okay. So in the medulla has a number of nuclei, and I think it's important that you understand when I say nuclei and we're talking about the brain, we're not talking about, like the nucleus that has DNA in it and stuff like that. When we talk about a nuclei in the brain, what are we talking about? A center? Yeah, that's what? A bunch of cell bodies, yeah. A nucleus in the brain is a big collection of cell bodies, gray matter, okay? So therefore, you can have a bunch of different nuclei in different parts of the brain. And so sure enough, in the medulla, you have some sensory and motor nuclei for the cranial nerves. You guys haven't learned about cranial nerves yet. That's coming late in this PowerPoint. And also, some of the nuclei are relay stations. We talked about the thalamus the other day, about how all the information comes up, it goes to the thalamus, and then the thalamus is kind of a relay area, and the thalamus decides whether or not to send that information on up to the cerebrum, where it can come to your conscious level. You can think about it or not, right? Remember the fan? Okay. Here's the diencephalon, the brain stem. Here's the thalamus, which we will talk about a bunch. You will see this on your brains that we cut up today, probably. So here, the cerebrum and the cerebellum have been removed. That's why it looks funky like this. Notice here's the pons. The pons is the thing that's going to connect right through here. It's going to connect the information coming up through the spinal cord and the information going down through the spinal cord to our somatic system. Remember our muscles? That is going to connect to the cerebellum. Okay? The cerebral peduncle up here is where the fibers are going to go that are going to go all the way up to the brain itself, the cerebrum. Okay, so here's the cranial nerves. I'm not going to go over them now. There's 12 of them, just so you know. Number 1 is the olfactory, that's the nose, but then here's 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. I think there's 12. Yeah, 12 is right there, a little bit out of order. Okay. You are going to know everything about every nerve. Yes, you are. But I will go over them one by one.
Okay.
Within the next hour or so of lecturing on the brain. How's that sound? Maybe. Let's just say that these autonomic nuclei. Did you guys know who that was in the back of the room just now?
That's Michelle Huss.
That was Michelle Huss. Yeah. Huh? She's just lost. She teaches classes. Yeah, she's teaching one. She does. I think she teaches it in.
That's why she was late, and that's why she left early.
Yeah, there you go. And that's Catherine Creech back there also. So we've now had 4 of the A&P instructors in this room in this hour. Pretty crazy, huh? All right. They just came by for the party because they heard we were having a good time in here. All right. So anyway, I don't like to make a big deal out of all of these nuclei because I think it's way too much for you to really have to know. I think there's a couple of things. I do want you to know that the medulla has centers that control the cardiovascular system, control your heart rate and so forth. They have, it has controls for the respiratory system, make you breathe faster, make you breathe deeper. And there's also a reticular formation, it's called, that helps sort of overlooks a lot of these autonomic functions, these automatic functions of our body. The medulla is kind of important because it has a number, it has 5 out of the 12 cranial nerves come out of it. And here they are, 8, 9, 10, 11, 12. Well, let's see. That's the last 5, right? And remember, the medulla is the lowest part, so you would sort of expect the last 5 cranial nerves to come out of the medulla, and sure enough, that's what that slide says. The pons is just above it, and it has 5, 6, 7, and 8. I think we've talked enough about the pons. The pons is involved in respiration. We have 2 systems here. We will talk about these when we get to the respiratory system. One is called the apneustic center. That means the center that makes you stop breathing. Now you may think, well, gosh, I don't ever want to stop breathing. Well, yeah, you do. Because when you go, and you get about that full, you want to stop. You don't want to keep going, right? You don't want to explode your lungs or your chest or something like that. So anyway, wasn't that funny, was it? Okay, I'm going to stop there. I do not expect you to learn all of these little colored areas. I think this is way too much. You should be able to identify the olives. And the reason they're called olives is because they're green. No, I'm just kidding. But they stick out on the bottom of the brainstem, and you'll be able to see those real easily. And the olives are important in terms of helping you orient yourself where you're at. Let's go back to the cerebellum for just a minute. We said earlier that the cerebellum is what makes you have coordination and allows you to move smoothly and allows you to stand and keep your posture, allows you to walk and step forward and not do it in a spazzo kind of way. When you look at the cerebellum, and you should look at the cerebellar slides that we have over in the lab, it's on your list. You should be able to identify Purkinje cells. Purkinje cells are these huge cells. They're big cells. They're large. They have lots of branches. Some of them synapse with 200,000 other cells. Whoa, think about that. 200,000 sets of little axons coming in and connecting to dendrites on this one cell in the cerebellum. Well, that's kind of how complex it is for us to be able to move and do it in a coordinated manner. Purkinje? Yeah, it's even spelled right there for you. Purkinje. Yeah. The other thing about the cerebellum that you should know is there's this thing called the arbor vitae. Now, when I say arbor vitae, what do you think? Tree, yeah. And when I say, well, that's for arbor, well, how about vitae? Life, the branches of life, huh? The tree of life. Well, it's really a silly name. But it just means that when you cut open the cerebellum in the sagittal plane, and you look at the two sides, it looks like a leaf. Okay? Show you a picture here in a minute. I'm going to skip that. Ataxia. Most any time that your cerebellum is not working properly, you have ataxia. Now, bet most of you have been ataxic at some time in your life when you had too much to drink. And this is exactly what the policemen are checking for. So when the policeman stops you for suspicion of DUI, and he says, close your eyes, touch your nose, you better be able to do it. If you go, you know, you're busted. And they're going to take you in and draw blood on you and do breath analysis and all that stuff. But the first set of street side evaluations that the police do, looking for somebody who has is intoxicated, are basically tests of your cerebellum. Okay, and you remember, you guys have seen, and I know you've never had to do this yourself, of course, but you know they have you walk in a line like this, and put your heel to toe, walk on a line, right? Same thing. They're testing your cerebellum and seeing how well your cerebellum works and whether or not you are intoxicated or not. Here's what the cerebellum looks like from the outside. Notice that it has really tiny little folia. These little layers of cerebellum are real obvious. They look very different than the cerebrum does up here, you know, with the gyri and the sulci and so forth. These guys are real different looking. And down the middle of it, there's a little thing that's called the vermis. I think vermis means finger. Kind of just a little piece of cerebellum that looks different coming right down the middle there. This is the arbor vitae that I told you about. This is what looks like the leaf. If you cut this cerebellum right down the middle, then it looks like this. That's the arbor vitae. Arbor vitae is like a leaf. See, it looks like a leaf.
I think she was talking about the ventricles, water, she's wondering if there's water inside there.
Oh, well, there's water here. This is the fourth ventricle. And you notice there's a choroid plexus that makes CSF right there on the floor of it. But there's also CSF out here around the outside of all the brains.
CSF not inside the
I'm having a hard time understanding.
I'm saying that there's not fluid inside in the cerebellum.
You're saying is there fluid inside the cerebellum?
No, the cerebellum is solid. I mean, it's solid brain tissue out here. You'll see that in lab today, okay? Because you'll have a cerebellum in your hands. I think I'm going to, I'll go a little farther. Diencephalon, it's kind of an integrator. It integrates the sensory information and the motor commands. The diencephalon, of course, remember, contains the thalamus, the epithalamus, and the hypothalamus, and the pineal gland. The pineal gland is important because the pineal gland helps us stay awake. It also helps us go to sleep. Now, you notice it says here that the pineal gland secretes the hormone melatonin. How many of you have ever taken melatonin to help you go to sleep at night? Well, I have too, and I think it works a little bit. Maybe I'm just too big a boy to need to take 7 pills or something. But the point is that melatonin is a very important hormone inside your body, and they can manufacture it, and they sell it at Costco in a big bottle for about $6. And it's a good natural sleep aid. If it works for you, that's great. I think it has a kind of short half-life. I think that seems like the times I took it, it kept me asleep till about 1 in the morning, and then I was awake. Yeah?
Sorry, I was trying to say, like, if you're using every night, you are not addicted, like.
Well, I don't think you'd call it addicted, really. I don't think your body craves melatonin. But if it helps you sleep, I guess that's okay. Does that mean, it depends on the definition of the term addicted, and I'm not really sure what that is. Yeah,
If you dig it like melatonin for like years, do you build like a tolerance to it?
I would think so. You know, just like anything. Yeah.
It slows down your, because you've got more, it slows down your own production.
Most hormones, yeah, when you take hormones, it cuts down your own production of the same hormone, yes. So I'm sure it does. But if you need a night's sleep, damn, it's not bad. Huh? All right, now I mentioned the thalamus, epithalamus. Those are the way stations, remember, carrying the information up to the brain. And the hypothalamus is the area of the brain that makes hormones for you. Now, you think it's the pituitary gland that makes the hormones. Well, it's a complicated thing. A lot of the hormones and a lot of the releasing factors are actually made up in the hypothalamus. And then they're released, and then those releasing factors stimulate the pituitary gland to make more of this hormone or that hormone that then goes out around your body. The point being, and the point that I really want you to know at this point of your education here, is that the hypothalamus is really important in connecting the nervous system with the endocrine system. You know, the nervous system is kind of the quick return, the quick response system, whereas the endocrine system, the hormone system, is the control of your body that's kind of slower, and it works mostly through hormones. So the hypothalamus is very key in this whole deal. So when you think about the hypothalamus, think endocrine system. It's part of the brain, but it's really involved in hormones. Okay? I don't think we need to talk any more about the thalamus. I think I've said that. The thalamus is deep down inside of your brain here, as illustrated underneath there, so you can't see it from the outside. We're going to start learning the different lobes of the brain here pretty quick, and they're pretty easy to learn because they all have this name of the bone that's right above them. Okay, so the frontal bone, remember, lives right up here in front, and the parietal bones live out here on the sides, and the occipital bone lives back here in back. So sure enough, we call this the occipital lobe, parietal lobe, and frontal lobe. This is the thalamus up close and personal. Please do not learn this. This is way too much. Just know that the thalamus is complex. It is the way station and the processor for lots of different things that it takes the information in, like vision, sensory, cerebellum, basal nuclei. These are having to do with your vision, auditory, and so forth, and putting it all together to send it up to the brain. I'm going to just leave it at that, but please don't try to learn anything like all these little parts. Yeah?
So for doing this, like for research, you have to go dig in there and destroy a little part of the thalamus and see if it was affected?
Mm-hmm.
Is that how they can do it?
How did they figure out which parts controlled what? Yeah, that's exactly how they did it. Yeah, I know. This is something that Michelangelo and those boys back then didn't know about. A couple of, this is the hypothalamus. The hypothalamus also includes the mammillary bodies. You'll be able to see these on your brain, so you ought to know at least that much about it. The infundibulum is the little stalk that connects the hypothalamus above to the pituitary gland below. You'll see that. I will tell you that when you go to lab and you get your sheep brains, you probably will not have a pituitary gland or an infundibulum, because when they get these things from the slaughterhouse, and the guys who work in the slaughterhouses are not exactly biologists, and if their job is to take all the brains out, it's kind of a shh, 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 it's about that quick. So they leave little parts behind, and the one part that I find always gets left behind is the pituitary. and the infundibulum, so don't freak out. But we do have it on our models very nicely. Let's just pass on that. Once again, here's this nice picture of the hypothalamus up here, and you need to see it has about 27 different colors on it. I do not expect you to know all of those different parts either. I think you should know that this is the infundibulum of the pituitary. This is the pituitary gland down here, and above that is this area of brain, which we call the hypothalamus. And we'll just leave it at that. You should also be able to identify this thing. This is the optic chiasm. This is one of the optic nerves. We'll go into them more clearly. Yes?
Was that whole color part hypothalamus?
Yeah. Yeah. So here's what a brain looks like. I think we'll just let that go till lab, and I think I'll stop right here. I got asked to tell a story that somebody listened to one of the old tapes, and they heard the story, and so I thought I'd tell it to you. Once upon a time, this has to do with the